Welcome to the Skilled Nursing Facility Consolidated Billing Working Together webinar. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter. Today, I'm joined by Alina and my team. She's going to be watching and monitoring and helping me with the chat. She's got some stuff she's going to place in there for you. She can do a little troubleshooting if you need that. But again, if you really are having technical difficulties, please email us at wps.gha.education@wpsic.com. That email is in the chat for you. Couple of housekeeping things to be aware of. The handout is available. The handout is the PowerPoint presentation. It is available on our live events page, which is on our website, wpsgha.com. Go to the training and then live events. You can go to the live events, find today, and then download that. Presentation, again, just to keep up. Do you need the presentation? No, the presentation is strictly to help you. It is for educational purposes. Though it does give you a lot of great notes and kind of helps you through some different stuff, it's not something that's needed. We will remove the presentation either later today or tomorrow morning, and then it will be available when we put the presentation back up into our encore presentation area, same area of the training center though. So be aware of that. I will be taking questions in the chat. I'll stop a couple of different times and we'll get through those questions. If you do have questions, put them in the chat so we can get them answered for you. And then there is also going to be a survey at the end, and I just want to remind everyone that the survey is very important to us, but also to CMS. It does give us a lot of feedback and information. So at the end, please take the survey, and we'll get more about that in a little while. Remember, this information is to assist you. It is not the official rules and regulations of Medicare. Those actually do come from the Center for Medicare and Medicaid Services. Any answers that we give today are based on the facts given in the question. I put that in because a couple of the questions, and you'll actually hear me say this, I believe this means, or I think this means, I think this is what you're asking for. And you'll be given the opportunity to put some information back in chat if you want more information. So all that information is the best we can give you. But remember, and I'm going to show this to you, the CMS website actually has the current rules, regulations, and all the stuff we have to follow. Our website is for guidance only, just like this presentation today. What are we here for? And this is the big one. We're here to look at skilled nursing facility consolidated billing and how to work together to make it as efficient as possible. One of the comments I did get was a great comment to open up with. Why is this so hard and complex? I didn't write the rules and I don't know why it's so hard and complex. I do know that in the practical working world, which is your world, right? There's a lot of steps that go through, and that's really what we want to kind of highlight and get a little bit more through. So we want to make sure we get through some of that general information. That's our overview. Then we're going to look at what CMS has for best practices, and then we're going to answer your questions. Now we'll stop at least 1 or 2 times throughout just to take questions, especially after that overview portion, because we do have some people that are new. And the overview is exactly what it sounds like. I will tell you, we teach 1 hour class that is just about what is SNF consolidated billing and what is the concept. So when I'm giving you an overview, it's literally just that. It's that 1 hour class, but compacted into hopefully, a shorter period of time. My goal is to answer 2 of the pre-submitted questions. 1, how does SNF consolidated billing work? And 2, can you explain the SNF consolidated billing criteria? So if we get through the overview and we answer those 2 questions, we've successfully completed the overview. Also, to the person who's attending who is brand new to Medicare, hey, thanks for joining us. This is a great opportunity for you to put some questions in the chat if you have them. I want to make sure that I don't leave you behind. I know everyone does maybe a little bit of a review, but we don't want to leave anyone behind. We really do want to help them and give them the best we can. Okay. So let's start with the basics. Skilled nursing facility consolidated billing is a form of bundling. What does that mean? This means that the skilled nursing facility that is being paid for the patient's care by Medicare. So that's a key part right there. Medicare is paying a skilled nursing facility for inpatient medically necessary care. That skilled nursing facility is responsible for most care provided to the patient while they are inpatient in a medically necessary Part A stay. That's a lot. So let's break it down and make it a little easier. In other words, The skilled nursing facility is responsible to coordinate the patient's care and then reimburse most outside providers for their services. If you've noticed, both times I use the word most or words like that, and that's because there's a list on the CMS website, which we will go to, and it explains which services are bundled and which are not. But remember, bundling is always something that's going to come first. So whether the SNF pays it, whether whatever, that portion of bundling will come before the Medicare physician fee schedule. Bundle first, physician fee schedule second, lab fee schedule second. All those other fee schedules and payment methodologies come second. Okay. So as long as we have that basic definition, that's where I want you to go. One of the things I do want to point out for those of you that are not familiar with the WPS presentation, anytime you see blue and underlined, it is a link and you can open it up. In this case, it's going to open you to the CMS website, and it's the Skilled Nursing Facility Consolidated Billing website. The reason I put this right up front is because this is kind of what I just read here, okay? I did not give you the actual act, but this will actually tell you, here's the federal law that requires this. It wasn't something that was made up. It wasn't something that wasn't put in place for a reason. It was put in place for a reason. Kind of walks you through. Later, we're going to look at these files, and I'll actually teach you how to get to this website. But I just wanted you guys to see what that link was or how that works if you're not familiar with that. So a couple of things to keep in mind. In a skilled nursing facility, there are two types of stays. That means that a Part A stay, which is when the bundling portion or the consolidated billing portion applies, is when Medicare is covering that inpatient care. Now, the inpatient care is for 100 days during a benefit period. I'll talk just a little bit about a benefit period in a second. The second stay is a Part B stay. And this means that for whatever reason, Medicare is not covering the inpatient care. So it could be that the 100 days are done and used up, that inpatient stay's benefit exhausted. Or it could be that they didn't meet one of the technical criterias. So for instance, they didn't have a 3-day hospital qualifying stay before entering into the SNF. But for whatever reason, it's not paying at that level. Okay. Now the level is medical necessity, inpatient. When you talk about the inpatient stay, please remember that that includes your room, your board, your nursing care, your PT, your OT, your SLP services, your social worker services. All of that is what's incorporated into the inpatient stay. The Part B stay is very different. So for instance, in an inpatient stay, it would also incorporate things like your lab, the technical component of an x-ray. All of that's part of it. Once you hit the Part B stay, it pays for a much more limited benefit. And a lot of that is automatically billed. We did see the word benefit period, and I was specifically asked about that. So to make this as clear as possible, a benefit period begins when a patient is inpatient in any facility type, hospital, critical access hospital, etc. Skilled nursing facility, definitely part of it. If the patient remains inpatient in any facility type, they leave a hospital and they go to a skilled nursing facility. That is a different type of facility. That is a continuation of the original benefit period. The benefit period must have a 60-day inpatient lapse before a new benefit period begins. The 60-day lapse only occurs when a patient is not having inpatient medically necessary services. So could you live in a nursing home? Sure, that happens all the time. Could that nursing home also have a portion that has skilled beds? Sure. When you leave that skilled level of care and move back down to the domiciliary or the living level of care where you just live there, you no longer are going to be in a medically necessary stay, and that 60-day lapse counts. When we talk about a Part A and a Part B stay, one benefit period can incorporate both. Just because you hit 100 days in a skilled nursing facility doesn't mean the benefit period ends. It actually can go over. Let me give you an example. Someone asked about a tube feeder. That person will only ever have one benefit period so long as they maintain the caloric intake, volume, all of that, that makes that tube feeding medically necessary for Medicare. because they will never leave a skilled stay and they will never have a 60-day lapse. On the other hand, if you have someone who falls and breaks a hip, they go in and get hip surgery, they get all that stuff done and they're good. And then 90 days later, they need a knee replacement. Because it's 90 days after being discharged, it starts a new benefit period. And a new benefit period would start with new hospital and new SNF days. Okay. And we're not going to get a whole lot into the hospital other than to talk about the 3-day qualifying. All right. So those are the Part A stays and the Part B stays, and hopefully that makes sense. During this class, you'll commonly talk about Part A stays because that's when, again, the bundling concept applies with one exception, and we will talk about that. We also do have two types of excluded services when we're talking about consolidated billing. One is Medicare excluded services. These are services that Medicare will never pay for. They are not part of the law. So for instance, a person is in a skilled nursing facility and they would like a fan. That fan is considered a personal comfort item. It's not medically necessary for them to have that fan. If it were medically necessary, then Medicare may be able to consider it. In this case, it's not. It's considered a personal comfort item. Medicare will never ever pay for it. Therefore, that is a Medicare excluded service. This is different than a skilled nursing facility consolidated billing or a SNF CB excluded service. A SNF consolidated billing excluded service is part of the Medicare benefit package. It's just who do you bill and who pays for that. Ultimately, yes, Medicare will pay for it. But as an outside provider, do you bill the SNF or do you not bill the SNF? So do you bill the SNF, who then bills Medicare, gets reimbursed? Then that same skilled nursing facility bills or pays you, or do you bill directly to Medicare and get direct reimbursement? So that's where we talk about excluded consolidated billing. So if I talk about skilled nursing facility excluded services, we're talking about those ones that do not get billed to the SNF, but they're billed directly to Medicare. If I say Medicare excluded services, that's something that's never payable and is the patient's responsibility. And let me say that again. Medicare excluded services are never payable and are therefore the patient's responsibility. Now, someone asked, along with excluded services, we have a contract with a skilled nursing facility, and typically this service is excluded, but we're contracted to do this for them. Well, then you bill the SNF. That's not part of consolidated billing. That's a separate contracted issue. It's not part of consolidated billing. It's not going to be by procedure code. It's not going to be looked up on the CMS website. That's a separate legal binding contract, and that's a different type of situation. So I want to make that clear as possible. Let's keep going on here. So reimbursement, include payment for Part A services and Part B services. So when we talk about this bundling, you can have a Part A and a Part B service, and it's still part of this whole bundling thought process, okay? Now, there are services that a SNF cannot do. It's just the SNF is not ever going to have the equipment, not normally going to have the equipment. They're excluded. The SNF can get a separate payment for them. Let me give you an example of a Part B service. Preventive care is always considered a Part B benefit. However, it is only billable by the SNF so long as the patient is in a Part A stay. Therefore, it's part of consolidated billing, but the SNF gets extra money for it. Hopefully that makes sense to y'all. But it's still a Part B service. The benefit category didn't change just because someone's in a skilled nursing facility. That didn't happen. And a Part A service would be anything inpatient related. And so that's where we talk about those. So the room, the board, the bed, all of that. It could also be a facility charge or a technical component. And that would be an example of some of the x-rays and diagnostic services that have professional and technical components. Professional billed to Medicare, technical built on, okay? So hopefully that all makes sense to you. What'll happen is if it is part of SNF consolidated billing, again, for reimbursement, you will bill the SNF. The SNF will bill Medicare. Medicare will reimburse the SNF will reimburse you. For those of you that are skilled nursing facilities, yes, I do understand that that was a very, very high level and simple way of explaining it. I don't need to get into the prospective payment system and the coding and all the stuff that has to be there. We're not doing that today. That's skilled nursing facility billing. It is a separate set of issues. This is just about how you guys want to work together, okay? Someone did ask me about this, so we put this one right on the slide. Are there times when a service is taken back by Medicare? And I'm assuming when you say taken back, what you're saying is you billed, maybe it is a visit, or maybe it's something related to the skilled nursing care, but you build it like in an office setting, or you build it in an outpatient hospital setting or something like that, and it got paid. And then all of a sudden later, the money was like requested back. And yes, that does happen. That happens because skilled nursing facilities, upon their first admission bill, which is usually 30 days, at least 30 days after, unless it's a much shorter stay, like 10 days or something. But let's say that it's a 90-day stay, they have to wait a full 30 days before they bill their first round. And that then admits them, but that tells our system not to pay anymore. Well, you've already submitted yours because you could have submitted it the next day or later that day. So yes, it does happen. When you see on my slide the common working file or the CWF, that's the communication hub. The communication hub, the common working file, actually can tell our system to take money back. All right. So billing, the SNF payments and billing are affected by basic things that are not done correctly. So when you don't bill the SNF a claim, and you know the patient is there or something happens, did you know that the SNF claim, which again gets billed every 30 days, can actually stop and have to be rebilled, which can affect all future payments, because SNFs must bill monthly or upon discharge. Now, the reason we say monthly or upon discharge is if someone's in for 100 days, they're going to get a 30-day, a 60-day, a 90-day bill, and a discharge bill. And then they're going to continue saying, hey, they're still here bills, which just continues the benefit. They're called no pay claims. Don't get hung up on that unless you're the SNF, right? So we want to make sure you're well aware of what is going on with that. Medicare pays the claims in chronological order for a skilled nursing facility. That means that January has to process before February, February has to process before March. So think about it, if they're adding late information to a January claim and it's affecting edits and audits and it's stopping that claim from paying, they can't submit. Also, that original claim goes to the common working file after it's adjudicated. So could that then delay other things happening, such as those takebacks? And the answer is absolutely. So there's a lot of things that can happen and kind of go back and forth with that. That's why we really recommend the best practices and the communicating a lot more than just in general, okay? So that's why this whole course was put together. All right. With that said, I do want to stop and I'm going to ask Aline if we have any questions in the chat. I don't want to miss anything. A couple of things I want you to be aware of. If you're asking me for a specific procedure code or does this cover in this, we'll talk more about some of that because that's in claims processing instructions, which by the way is just in the next section. In this case, let's just focus on those general information style questions. So Aline, do we have anything in chat?
Yeah, we have gotten a few questions, Tom. There is a question that is specific to some codes, so we're going to leave that one for now. One question from Nancy says, how do you get access to the common working file if you are a Part B provider?
Oh, good question. Common working file is going to be available to you, one, through our website. That's your number one way. And if you're not familiar with that, I'm just going to show you right quick here. You can come to the WPSGHA website. This secure section right here gives you access to the common working file. I'm going to use the portal user manual. What I'm going to do is just kind of scroll through it, and I'm looking for the word eligibility. So look away if you don't like a fast scroll, so I apologize because this is the easiest way I can find it. What will happen is in this eligibility check, which is under patient, this actually is the information from the common working file. It uses a HIPAA 270, 271 standard transaction and actually takes you out there. This is free to use for anyone that has or works for someone with an NPI that bills WPS. So J5, J8 providers and their staff can use this as long as they're given permission. Check the eligibility and it'll walk you through how to get to the common working file information for you. There's also, if you're on CMS's website and you type HETS, I'll define for that for just a moment. The HIPAA eligibility transaction section, it's called HETS, H-E-T-S. This is a way in which you can actually directly access the same thing, but it uses the same transaction. the same 270, 271 transaction, but it's something you can get right here. You can find out more about it, system maintenance, all that kind of stuff. So either one will get you access to it. So hopefully that answers your question, Nancy. If not, throw back in chat, give me some more information. I'll help you out a little bit more there. Any other questions, Aline?
Yeah, we do have a couple more if you have time. We
Sure.
have when patients in a SNF and has Medicare Advantage, will I bill Medicare or Medicare Advantage?
You will bill Medicare Advantage, whatever the Part C plan is. Remember, it still has to follow their rules. So you're not gonna like, and you're in this class and you're hearing about the consolidated billing and you're hearing about all of that. That may not apply to a Medicare Advantage plan. We know that it applies to traditional fee-for-service Medicare, which is Part A and B. That's what we know. That's what Aline and I can talk about. So if you're talking about a Medicare Advantage plan, you have to call them, figure out with them what their benefit is, how their benefits work, all that type of stuff. So if they're in an Advantage plan, yes, you do need to bill the Advantage plan. Next question, if we have one.
Yeah, one more. Can you address the proper place of service for an excluded service when a patient is in a skilled stay?
Ooh, sure. And the reason I said ooh on that one is because it's not a single answer. And I want to say that you're talking, first of all, let me explain. A place of service is something that is billed in a 1500 claim form or an 837P. If you look at the directions within the internet only manual, and Aline, I'm pretty sure if you scroll down somewhere, I gave this reference, but it's chapter 26. And it's completing the processing form for the 1500 data set. There is an area within that that says place of service codes and definitions. And then when you go down, you'll get a whole list of them. You got to go to the bottom of it. There's an area called special considerations for services furnished to registered inpatients. What it's looking for is that if they're in a skilled nursing facility, there are two different potential places of service that you could use. 31 represents the inpatient Part A stay. 32 represents the Part B stay. So I'm not really sure exactly which one you're looking for there, but please remember that 31 will override an 11. 11 is place of service office. If they are in a Part A stay, you will use 31. If they're in a Part B stay and you're doing it at the skilled nursing facility, you use place of service 32. If they're in the office, you use place of service 11. So hopefully all of that makes sense. I'm really hoping I got enough information without going too in depth into that one. And Aline gave you hopefully the reference for that, but we'll talk more about that a little bit later if we need to. I'm going to go ahead and move on at this point just for time wise. So one of the things that comes up all the time is what is the best practice, or how do we best work with these skilled nursing facilities? How do we best get everything we need? And my answer to you is first, it is about communication. You're going to need to somehow figure out how to best communicate. We've had some providers say to us, and whether it's a skilled nursing facility or not the skilled nursing facility, we actually go back and forth each month with people we commonly work with. We'll send them a list and say, do you do any services for so-and-so? Or is this person in your skilled nursing facility? Yes or no? So there's a variety of different methods and you can develop your own. What I do want to remind you is that it is up to the providers to work that out. Billing is not something that Medicare is involved in. What we are involved in is under the federal law, and we'll talk about that. The federal law, and again, we read it about the consolidated billing. I showed that to you already, and I will show that to you again, but there's some different basic information that you do have to follow. One, the skilled nursing facility is responsible for paying for a service that is part of consolidated billing, whether they knew or not that the patient went to that service. And it is based in the procedure code on the website. CMS does give you, whether it's a skilled nursing facility or outside providers, a variety of different forms which you can work with and manipulate as you need to for what you need to do. Somebody asked if this is similar to an ABN where the verbiage has to stay the same, and the answer is no. An ABN is a separate form. It's the Advanced Beneficiary Notice of Non-Coverage. It's a completely separate form, has its own, I guess, rules. So please keep in mind it's not the same thing at all. Okay, it's not the same thing at all. And I don't want people to get confused between that and these forms that I'm going to show you next. Okay. Oops. So keep in mind, CMS does have a best practices guideline on their website. I do highly recommend that you take a look at this if you're working with skilled nursing facility. There are a lot of downloadable agreements and notifications to help work together. Coming from the SNF, going to the SNF, whatever we need to do there, there's a lot of different things. So we're going to look at these. These are recommendations set forth by CMS, and they are for everyone. WPS does have a few recommendations. I'll sprinkle those in as we need to. Okay. Claims processing instructions. Our goal is to obviously get the claim processed, get it sent to the correct place the first time. What is the correct place when you talk about this? It is one of two things, or one of three things. One, should it go to the skilled nursing facility? Two, should it go to Medicare? Or three, should it go to the patient? Those are your three options, and which is best if you're an outside provider. As a skilled nursing facility, you want to evaluate one, do you add that to your claim, right? Charge it to Medicare, then pay the provider. Is this really supposed to be patient responsibility where it's not something? Or do you deny it saying, no, pay by Medicare, not us, pay by Medicare, send directly to Medicare. So we want to make sure we're getting all of that in. I'm going to go ahead and jump back just 1 second here. You will see this best practices guideline. Let me open that up because that's going to give us a chart too. So when we go to CMS website, a lot of people like, and I think this is the easiest way to find it. I will show you a longer way if you want that. But just type best practices. Best practices guidelines. Wow, that was really easy. Okay, so these are just what they are, some different things like that. And it talks about all the consolidated billing. It's going to tell you about the different forms. So the reason that I brought you here is this is what we're going to go through. This is what CMS does offer for you. But I do want to scroll to the bottom of this. All right, when we get down to the bottom, that's where they're all located. Okay, so this is your instructions even for consolidated billing. This is that flow chart that was on the slide. So here's where it is, right? Now, if you say to me, hey, I'm on the CMS website and I can't find it and best practices isn't coming up for me, very cool. What I want you to do is start off with cms.gov. Next, I want you to go to the term Medicare. Easiest way, coding and billing. And I know this is going to seem a little weird, but SNF Consolidated Billing over here. Now, the reason that I typically have you come to this is where the files are located, okay? Then you're going to go to related links down here. Read all about consolidated billing. Go to the very bottom of this page. This is why it's hard to find, by the way, if you're wondering why it's so hard to find. When you get down to the very bottom, see this best practices guideline? This is what we're actually looking at. And it's exactly what I was just showing you. So again, start out here, cms.gov, Medicare, coding and billing, consolidated billings, on the right side, skilled nursing facility consolidated billing. Scroll down to the bottom of this page, go to related links, consolidated billing. Once there, scroll down again, and just above the downloads, you'll have the best practices guidelines. So again, I don't want to make it, that's why I went the way that I did. But if you can't find it, it's always good to have it. This is a flow chart. It's going to help you kind of determine back and forth. Key things you'll need, CPT codes. You cannot determine these without the CPT codes or the HCPCS codes. If you don't have a procedure code, you will automatically not be able to use whether or not you should bill. So you can't even determine which agreement to give or what's best for you because you don't have that. Okay, so what do I do? Well, you come down and you start in, send back to, so let's say validation. Does the bill contain the following? Okay, no, it does not. Send it back to the vendor. In other words, if you're a skilled nursing facility, we can't do anything with this, right? Give it back. Where did the service, were the services within the Part A stay? Part A stay, what does that mean? Medicare is paying for the inpatient care. Yes. No. Okay, we need to make sure. Okay. Is the Bill, pre-bankruptcy, yes or no? This is just something that would happen very rarely. If you say, yes, do not pay consults. If it is, okay. And we continue down until we get into more of determining SNF responsibility. And this is where a lot more of the information comes from. It's just a nice way. I will tell you this chart is still old enough that it says UB92 and we all know it's a UB04. Information is still correct, still works the same way. It just kind of helps you a little bit, okay? I'm going to jump back here. So now we get into all of these different agreements and notices, and you'll have a slide built for each one. So I'm going to go through them. I'm going to follow through on your slide. So if you're on slide 15, it should say like agreement. Maybe it's slide, I'm sorry, I don't know the slide number. I want to say it's 15 or 16. It'll say agreement 1. Well, that'll match over here if you see you've got sample agreements. So let's just do agreement 1. Opens it up, it's a PDF, and it really does explain what this is. This agreement is written by the SNF, so it's from a skilled nursing facility, identifies the wishes. So, okay, it's share with external. The goal is to outline some of those billing basics, really when to bill, why to bill, what needs to be done, all of those different things to make it. Please note, the SNF can tell you, hey, if you don't do this, this is what we're looking for. Give you a number of days to get that into them. That is designed because the SNF cannot be paid sometimes for those late charges. Sometimes those late charges hold up other bills. So we don't want to do that if we don't have to, okay? You want to make sure that you're following all these different blanks are filled in and things like that. Really, the goal of this is to give you this part right here. As an outside provider, the goal is for the SNF to give you some information on who to contact in case you have questions, anything like that, okay? And yet to give you all of the basic skilled nursing facility information that they need. One of the questions we were asked is, does a skilled nursing facility have to accept or expect the same thing as Medicare in terms of a bill? I can't tell you what they need to accept or expect in terms of a bill. If they have other data sets that they need, they may have something different, especially when you talk about how you bill Medicare, because there are different claim forms that actually come into Medicare. So under this, the SNF will give this to you and then explain further. Can a skilled nursing facility adjust verbiage on this form to help people understand? And the answer is absolutely yes, they can do that. So let's just keep going, and we did we did agreement 1. So let's move on to agreement 2, which would be your next slide. That's here. It just looks a little bit different. It just leaves timeframes, payments, etc. It's not actually that much different. It is given under a different perspective, so it's given for some different services. It just depends on if it's a supplier or a provider or like a professional. Okay, so who are they getting this from? Any of that type of thing. When it says resident here, it's talking about the patient in the skilled nursing facility. But it does, again, you can kind of follow it through. It'll talk about some of the different things. Now, remember, it's a little bit different because a supplier is not a person. A supplier is normally like an ambulance company or a lab or other types of things that would require sometimes even an order. And so it's telling you, hey, what are we doing? Who meets this? Okay. Who meets the supplier definition? What do you have to know about that? So they're used for slightly different purposes. But the agreements are set forth to help you guys understand both the skilled nursing facility and the suppliers and the other providers understand the basic criteria to really work together to make sure that everything is done appropriately. As you can see, there's just a lot in here. I will tell you that someone asked me about a SNF payment and do they have to pay the same as Medicare? And the answer is no. Even if you're a participating provider with Medicare, this does not affect you. Your participation agreement is between you and Medicare. That's what sets your payment rate for Medicare. It's not what between you and the SNF. It doesn't set your payment rate between you and the SNF. The only way to actually do that is, one, to have a payment rate established like in an agreement or a notification, and we'll talk a little bit more about those in just a second, or to have a legal contract between the two of you and say, hey, you get it to us within 30 days, we'll get you this payment within 30 days, something like that. I'm totally putting 30 days out there. Please don't hold me to that, or even, say that. Use a legal consultation, have them kind of help you guide through writing that legal agreement should you want one. Does Medicare require a legal agreement? And the answer is no. So great question, but no, Medicare does not require a legal agreement, nor do they require any of these forms that I'm going through right now. So again, the first two are just agreements. They're how we'd like to see things build, what we'd like to do between an external provider in the SNF versus a supplier in the SNF, but they're basically the same thing, just establishing all of that. All right, on slide 17, you're going to read your first notification. Now, sample notification 1 is what we're going to look at. This is a weekly service log. There we go. Sorry. And so this log says, okay, during this week, the patient had this much. Is it a covered Medicare Part A? Okay. And who is the SNF or supplier name? What's the services they're expecting? Who's the contact person? Again, this is the key important piece, so you guys can communicate back and forth. And then it just lists all the different things the patient had done, whether it's a data service covered by Part A, etc. It's just a log of services the patient had during that week. This notification is just to make sure that you don't miss anything, that they have everything. The number one thing that this is used for is PT, OT, and SLP, which is commonly, again, let me say this again, commonly provided by the skilled nursing facility. But an example of when it was not, they had a physical therapist who went on emergency medical leave because she was having a baby and had complications. No idea she was going to go. Suddenly she's gone. And okay, what do we do? Well, before they could bring someone else in, they still couldn't just stop having PT services for their people in the skilled nursing facility. They use this log because the SNF is responsible for them. This then helped them track back as to what they should be making sure gets billed to Medicare, making sure gets put on the SNF claim. So that's an example of how this log was actually used and when we actually did see it used. If it is not as part of a Medicare Part A covered stay, if you say no, it's probably something that should be billed directly to Medicare or billed to the patient. Because if it's not medically necessary, it's not part of that covered stay, then there's a reason for that. Okay. The next one is actually going to be, where is it? Notification 2. And that is the one for ambulance transports. Okay. Now this one comes into question a lot because ambulance transports are a bit more complicated than just, yes, they were transported or no, they weren't transported. First, it has to be a medically necessary transport to be covered by Medicare at all. And that's what this part of this is looking at. Why was it medically necessary for this person to be transported? Not that they couldn't have gone in a wheelchair van. If they could have gone in a wheelchair van, but one just wasn't available, that's not a medically necessary transport. That's not billed to the SNF. That's not billed to Medicare. That's actually billed directly to the patient. So there's a variety of different factors that go into it, but this will help the ambulance transport company know whether or not they should bill the skilled nursing facility. And so that's what these categories are for, is to help them look up and know whether or not they should or should not. Okay. And by the way, for those of you that are not familiar with this, and I know I do have a couple of ambulance suppliers on here, the ambulance transport, it's more complex than just what I explained, and please understand that. But it also takes me an hour to explain it. It's a full hour class all on its own. So please be aware of that. Well, this makes it sound really simple. It's really not. There is a full hour class on it. And I'll talk more about where to find those in just a little bit. All right, notification 3, which is on slide 19. This one is for physicians and non-physician practitioners, okay? And the reason that we have this is there are some services that are going to be responsible by the skilled nursing facility. Now, these services are set differently because if it is truly just a physician's or a professional services, those are not billed to Medicare. We're going to take a look at that with skin substitutes. If it is not, if it could potentially be a therapy service or a professional service like that, wound care, that's billed to the skilled nursing facility if they're in a Part A stay, and if they're in a Part B stay. And then there's also these other services like radiology lab that have two components, and you do have to separate the components. And the skilled nursing facility gets the technical component, while Medicare gets the professional components. You got to make sure you build the TCs and the 26s. And so this is what this is explaining about the professional services. Okay, lots of different stuff. It does get you the websites and the things like that. We're going to take a look at those in just a few moments. All right, so you guys are getting kind of the hint as we go through notification. What are we on? Notification 4. Sorry, I lost my notification number there. Again, this is another one for physicians treating in a Medicare Part A stay. It just explains it. This is one where you talk about those professional technical components when you do have to split bill. So a skilled nursing facility may give this or send this with to say, hey, we know they're having this type of a procedure code. It's a lab or an x-ray, and you need to bill us this technical component, okay? Not Medicare. This also then talks about incident 2 codes, which are then billed to the SNF. There is, when the patient is inpatient in a Medicare Part A stay, there is incident 2 is not recognized by Medicare. And incident 2 just means that a lower level provider or a lower level person is billing under a physician or under a qualified non-physician practitioner, and their services are being reimbursed as that. So that higher level. Really brief, really easy explanation. Yes, there's more to it. I do understand that, but I wanted to bring it out that that's also in here. Okay. So it just kind of a nice notice for that type of information. We'll go to notification 5 next. Notification 5, again, you're going to look up, it's again, physician and practitioners. And it really differentiates some of the services. So I kind of mentioned some of it. It's another form of a notice to a physician or a non-physician practitioner, depending on what they're doing. And you really do have to pick which one is best, because some of these services are not as easy as you think. Okay, not as easy as you think. And we'll talk more about those, but it just gives you some different options to help you through the process. Notification 6 is for outpatient hospital departments right here. So it's a SNF giving it to an outpatient hospital department, and it just says, hey, hospital, here's what it is. What are they coming there for? And should you bill the SNF or not? An example would be an emergency room. If it's truly billed with the correct revenue codes for emergency room, it is an excluded service. Now, why do we say truly billed with that? Well, what if they don't bill that revenue code, or what if it's not done that way? Well, then it falls into a different set of rules, and we have to look at different things. So we do have to make sure we fall under everything like that. Really, this one is looking specifically more at the CT scans, the outpatient surgeries, because there's a limited number of surgeries a SNF can do. So do they fall into that as well? So you can see there's a variety of different factors, and you do want to list the reasons and the types of things. And then check a box. And again, the box is important. It's going to help them look at what they need to look at, them being the facility, the outpatient hospital or the outpatient facility, because they do need to look up different things with files. And if you notice, it does say for specific HCPCS codes, procedure codes. So everything is about that. And that's really what we can wind up coming back to. And I will show those to you in just a moment. And the last one is notification 7. And this is, again, to an outpatient department, but it's for a little bit of a different reason. And so you want to make sure that you read through these differences. Is it an ambulance transport? What is going on with it? And it'll be based in the file that you use to look this stuff up. So this one would be the Part A file, major category 1, and I think it's major category 1. All of this stuff will fall into that. Probably 2A's maybe in there, 2's also in there. So you want to make sure you're looking at the files to make sure you know which one to use. And really, as I stated before, these are suggested verbiages. These are sample notifications, right? So just because they say this and you want to alter it and you want to make it more specific to what you need, do it. It's a sample. It's to help you. It's to support you. Maybe you like the verbiage in 3 and 5 and you want to combine it. Okay, do that. Do what's best for you to get the information out there between each other. Okay. So those are your sample notifications. Before I leave anything, one of the big ones that keeps coming up, and the question was, is if we're in this and I want to find out about the actual files, where do I go? Well, it's not going to be in the skilled nursing facility or the best practices or any of that. I'm going to go back to the PPS page. Now, this just talks about how a skilled nursing facility is billed under their prospective payment system and how they're paid. What we have to do when we want to look at consolidated billing is scroll down and find the related links and read through the different related links that may be here. I actually find it easier just myself, by the way, go back, go to Medicare, go to coding and billing, and go to consolidated billing. For me, this is the easiest way to find these files. The files are all listed on this side. You can see them real quick, real easy there. So that makes it easier for all of you. Okay. Let's move on into on the next set of slides, some questions and things we have. We did go through all of these. I just didn't advance the slides as we went, sorry. The first set of questions we have were all pre-submitted. Okay. Do we need to use the sample forms as is? And I think I've said this a few different times. No, you can alter them as you need to be. They're sample. They're sample forms. Unlike a mandated form, such as the advanced beneficiary notice or non-coverage, they are sample. Does billing the skilled nursing facility require a legal contract? Medicare does not require a legal contract. This may be a best practice, but it's not required. Remember, the Social Security Act actually has a section, and it's part of that responsibility that the SNF pays you. I'll answer that in just a couple of questions for you. Can WPS or CMS be involved when the SNF doesn't pay us? No, this is a legal dispute. It's like any other debt that's owed to you. You're going to use the same principle. So if someone owes you money, what do you use to get that money? That's what you need to do. Where does it state that the SNF is responsible for services furnished directly or under arrangement? And this is actually in the Social Security Act. So that's a federal law, and it's in section 1866 A1H2. I gave you all the stuff I could get there, hopefully, to get you to where you need to be. This one is a little bit tougher because it is, it's reading through it. It's that legalese. So sometimes people like to give this section to their legal counsel and be like, here, this is what I need. And they actually have to read through it. If you've ever had to deal with some of the laws, it does get a bit more complicated. So, all right, I am going to go ahead and advance my slide, but I'm going to tell you that before I leave chat questions, I do have a couple of more pre-submitted questions that did not make the slide deck. So let's read through these. The SNFs will deny our UB04 claim form stating we need to put a TC modifier on the claim. How do we get them to understand that this is a physician, not a hospital? We have some facilities that process the hospital claims using the physician tables. It's hard for them to understand why they need to use facility hospital files. Please help us using the terms they're familiar with. Thank you. This one gets to be interesting for me. Because can you tell me what the service is? And I don't have that by definition. Now, typically when there's a TC and a 26 modifier, the SNF should be, skilled nursing facilities, are you listening? You should be denying these, and they should be billed with a TC to you and a 26 to Medicare. There's an entire file on the CMS website that shows us that. So that file is under this. Well, for this year, it's the 2025 Part B MAC file, but you'd go through the appropriate year. So we'll just open the 2025 MAC file. When you read through, these are going to have some updates. It'll say add to file number. We'll get down to the files, which are actually located under downloads on the bottom. Part A stay, professional component to be submitted with 26 modifier. This means that during a Part A stay, professionals must submit to Medicare with a 26 modifier for the following components. But what does that translate to for a Part B stay? For a Part A technical stay. Well, if you're submitting the professional stay to Medicare, wouldn't you then need to submit the technical portion too? Yeah, the SNF, but only the technical portion because Medicare is taking the 26 portion. So some people get confused over this and they're like, but why did that do that? And why isn't that working? And what's going on with that? And the answer really quite simply is it really depends on what you're looking at with this one. So let's take a look at this file. Now, I will tell you, this file is a compressed file. I don't know if y'all can see my computer working under, oh, nope, apparently not. So what it does is it actually opens it up and it'll open up into the different files. Oh, this is file 1 and we want file 2. There we go. So this is file 2, which is this file right here. When we open up this file, this is just an Excel document. And I had this open and my Excel has decided to stop working. You can see that is what is going on. Oh, so I apologize. My Excel won't open right now, but what'll happen is you can look up the procedure code and anything on this has to be split billed. Again, there it went. So it actually says Part A stays services submitted with a modifier 26 to Medicare. Okay, well, that means the TC goes to the skilled nursing facility, but I have to have the procedure code. So I can't just, hey, here it is. I can give you the basic definition, but then you can come out and look up any of these procedure codes. Okay, so there's one for you. All right, so we'll close out of that. But this is one file. Again, skilled nursing facility was a professional technical component. There we go. Let's jump back to our slide deck here for a second. Oh, no, we don't need to, sorry. Back to the questions. Which party is responsible for professional charges at a nursing home when the patient is skilled? The question is which professional charges? And my reason for asking this is, are you talking about professional PT, OT, SLP, maybe social work charges, or maybe like nursing charges? Those are all considered part of the professional component charges, but those are actually the skilled nursing facility's responsibility. On the other hand, something like a doctor is not, and that's where I first pulled up on this one. File 1 is your professional services, okay? And so if we open that back up, it looks like this, and it literally lists a whole bunch. Stuck. It'll list a whole bunch of different services that are considered professional. Once it's on this list, you will not find it on any other list because these are professional services and because these services are only available to Medicare. Okay. So a lot of people ask us about some of the services and like skin substitutes and all that. We'll look at some of the different things here in just a moment, and we'll actually look at the procedure code. So if you have a procedure code, this would be the opportunity to go out, open this up and say, what is a professional service? Let's do 15271. We find out, wait, this is a skin sub grafting, and this is a professional service only, which means the skilled nursing facility should not be paying you for it. That opened twice? That did. So that's kind of how it works, and you can see there's just some, the range that goes with that. What happens? What other types of codes could you find on here? What about 97597? Oops, not in that range though. Let me get that back off of there. Oh wait, that one's not on here. What is that? Well, that's wound care. We're gonna talk about that one in just a few moments. Okay. So hopefully that kind of helps you. Oops. 97. So here you can see this is considered a professional service. It's wound care, but it's not on the physician's list. So let's take another look at another list where that would be. And that one would be under file 4. We're just going to save that to my desktop real quick. I do not have this one saved because I did not open this one. Sorry, y'all. So on file 4, which again would incorporate the wound care questions, what this is PT, OT, SLP services that even when the patient is in a Part B stay, so Medicare is no longer paying for the skilled nursing facility portion, the Part A portion, there are still certain services that must be billed back to the skilled nursing facility. Wound care is an example of one of them. Remember, when you're looking at the place of service for these ones, if it's the Part B stay, such as physical therapy, the skilled nursing facility is going to bill that. If you're talking about the physician service, you would bill with a 31, even if they're in your office, if it's a Part A stay. All right, you guys, I can't get this one to open up, so we'll skip that for a second. Oh, there we go. So again, if we look at this one and we say it's a 97597, Active wound care. This gets billed back to the skilled nursing facility. They're responsible for doing it. It would also be on the Part A files. The Part A files do look a little different, and they're going to be in a major category. Major category 5, I believe it is. So again, that's what you want to keep looking at. When you look at these ones, now this is again same set of files, except this says they're in the Part A stay versus the Part B stay. Now you got to find these major categories. In this case, we're just going to use the same exact code. And what we're going to look for again is that 97597, right? We scroll down and it says, okay, yep, this is an inclusion to the skilled nursing facility. So this doesn't matter if it's a Part A or Part B stay, it is the skilled nursing facility's responsibility to pay and to bill Medicare for it. Next question, what services can be carved out? That's what I'm explaining with these files. If it's on these files, you want to look for the word inclusion. If there's no word inclusion on this one, it would be an exclusion. So there's just a variety of different files. We did that one. Again, let's go back and emphasize this. Places service 31, 32, and 11. Places service 31. If the skilled nursing facility is in a inpatient SNF, then it would be places service 31. Inpatient medically necessary SNF stay. If they are inpatient, but the stay is not being paid for, it's not the Part A portion, it's the Part B portion, then that's a 32. When you talk about 11 comes into play during the Part B stay. You don't have to build a 32, you would build an 11. If they're in the Part A stay, you need to build a place of service 31. Okay, keep that in mind. It's really where are they inpatient at? And that's part of that rules and regulations as set forth by CMS. All right, I'm going to go ahead and stop for just a moment. I did get through all the pre-submitted questions. Aline, do we have any questions in the chat? I know you guys, I know it's time, but I do want to make sure we try to get at least some of your chat questions answered.
Hi, Tom. I tried to answer a couple of them while you were talking. We had a question about how to find the site to connect to common working files. So I did give everybody a link to the portal user manual. So hopefully that was helpful. We also had a couple people who were still confused about the place of service, whether it would be 31 or 32. So I did add an excerpt from that manual reference that I added earlier, where it specifies those special considerations for services furnished to inpatients. So hopefully that helps. Lisa had a question about skin substitutes, but you actually took one of her codes, the 15271, and brought it up on the spreadsheet. So I hope that helps her. And then we had a question from Liliana who says, patient is transported to the emergency department and has a procedure that's on the SNF Consolidated list. She gives an example of a blood transfusion with a 36430. Would it be considered consolidated billing because the CPT is on the list, or would it be excluded because it was an emergency department visit?
Ooh, that's a great question. Let me just show you how that works here. So I'm going to come back, and I'm back on this SNF Consolidated Billing. This is where I downloaded that. What I want you to do is go ahead and open up the Part A file and then scroll down. So here is this general explanation, which I did not show, but it is the PDF. I did show you the big long list, which is an Excel file, but let's take a look at this PDF. So we want to focus on what you're talking about right here is major category 1, and we're going to hit up G. When they use the revenue code 045X for emergency room, it will override the fact that it was done or that the procedure code is on the list, as long as it's billed with revenue code 045X. So it's very hard for us to answer that because Aline and I don't know what that emergency room is going to be billed at until, or did they leave the emergency room and go to a different part of the hospital, which is going to get a different revenue code. So this is really what we have to look at. And maybe that's a question you need to ask the hospital, because unfortunately, I just don't have a good answer for that. Aline, do you have anything more, a better way of explaining that?
No, it really comes down to which codes you're using and how that's going to be billed to determine whether or not that's truly something that can only be done in the emergency department, because skilled nursing facilities don't have an emergency department. And so, that's how CMS has made the determination of whether or not it's outside the scope of what a skilled nursing facility would be expected to perform. And so that's why these tables are so important. So you did a really good job of explaining that. I don't have anything else to add.
Okay. Yeah. So again, you're going to have to check a couple of basic things and make sure that this revenue code is on the claim. And that's your basic gist of it is it being billed as an emergency room code? So I don't, that's what we have to offer on that. Is there any other questions that we can quickly address or that we want to, or is there any other questions? I guess let's just go through them.
Well, another question that came in, since I clarified that if the patient's an inpatient in a skilled nursing facility, CMS does require the use of the 31 for the place of service. Nancy would like us to clearly answer if they have to use the E&M for a skilled nursing facility. Not sure if you can answer that, but
let me make this as clear as possible. Yes, you use your skilled nursing facility or your nursing facility E&M codes, not your office codes. When you're billing with 31, it has to be a nursing facility code. Otherwise, our system goes haywire crazy. And it'll just won't even process your claim. It does not like that. So yes, if you're using place of service 31, make sure that you use that code. If you're using, I'll use this as an example. If they're in a swing bed, which is an outpatient hospital, or which is a hospital department, then you would want to use 21 for inpatient hospital and use the hospital codes. So yes, make sure you match that place of service. Make sure you match it. You should not be using office codes unless you're using 11.
Thank you. And the last thing that I see is from Neefu, and she says about ambulance billing.
Oh, okay. I'm going to make this one as easy as possible. I did see this one come in. What I really would recommend is if you have not used the WPS Government Services YouTube, take a look at our YouTube. Go to our playlist. If you type the word ambulance right here, we have an entire section on ambulance billing. It covers consolidated billing. It covers all kinds of stuff, but it's a big playlist and it's an ambulance suppliers. It has 24 different videos that will help you through ambulance billing, including the consolidated billing just specifically to ambulance. So that's where I really do have to recommend you go just due to time constraints. And again, I apologize that we ran over. Aline, do we have anything else?
No, but she said, awesome. Thanks a bunch.
Okay, so I apologize for going over. I just didn't want to leave anyone hanging out there with questions. We want to get as many of those answered as we could. So just a couple of quick things to remind everybody. You will be getting a certificate of achievement, a couple of things on there. It's going to come in an email. It's probably already there. I did have it set to come right after the event. Please make sure that you keep that email because it does have your contact hours, and a lot of the governing bodies that give CEUs, that's what they're looking for from WPS is this contact hour statement. If you did not sign in with your email address, you're not out a certificate. What you have to do is send us a follow-up question. Okay, so for anyone, you have 7 days to send us follow-up questions. You can email those to us. It's wps.gha.education@wpsic. Please make sure you put SNF CB working together, however you want to do that, something to indicate that. If you're emailing for a certificate in the body, please incorporate, I need a certificate. Here's my phone number. Your phone number must contain an area code, so 10 digits, 10 digits. Okay. But otherwise, we'll take questions for 7 days. Survey, please take our survey. You'll hear this time and time again. The surveys really do help us. We really do look at what you guys are asking for. We're going to give you 1 in the email a way to do it. 2, I'm going to give you a redirect after this where you can do this. 3, I'm going to have Aline throw a link in the chat and you can take the survey there. And 4, I'm going to give it to you on demand and this little picture that looks like the top picture here. But we just really want to know what you'd like. Good, bad, ugly. What did I do well? What do we do well as WPS as your processor? What could we have done better? But also, could I do better? And ugly. Did you like my PowerPoint? Did it help you? Did the resources help you? I know I went to a lot of websites and other things to try to give you guys some additional support. So did you like that? Was it helpful? So good, bad, ugly. Please take that website survey. Please remember we do listen to you. Oops. We do listen to you and we will take those into account. That's all I have for you. Thanks for attending. I hope you guys have a great day and you may now disconnect.